Hello everyone, this is Dr. Avinash Singh Chauhan from Shivaya Hospital, specialist in Ayurveda, AVN, spine and joint disorders. Friends, today I am going to share you a very interesting story, and I am very happy and elated to be share this very interesting story to everyone. Right now I am in Hyderabad and I am organized where almost 4 days of the fourth day of the Hyderabad camp, and it started from 26 September 2024 and up to the 30th. Today is 29th. So once I have started, and it was a very interesting story of Hyderabad, and a lot of patients, they have taken my treatment from the south especially. That is why we have organized the camp in Hyderabad, and I am very elated to share the information. We have treated almost more than 250 plus patients. It was a very interesting for us also, because a lot of patients, they were calling from Hyderabad, and now I have met so many of old patients who has taken my treatment earlier. अभी क्या मैं देख पा रहा हूँ कि उन पेशेंट्स में दो विजिट उन्होंने करी थी मेरे यहाँ पर, एंड जैसे ही मैंने कैंप को ऑर्गेनाइज किया, सो दे केम एंड दे met to me. So what I have observed, 3 years before I have taken the treatment to him, and now he is living their life normally without any problem. So it is very proud moment for me. They were feeling comfortable, they are doing their activities without any problem. So now I am going to share one of the most finest story to all of you. As everybody wants to listen, is avascular necrosis is possible to reverse? That is the one question every AVN patient want to ask, and every patient they are hesitating to ask this question. Sir, is it possible to reverse avascular necrosis? Because in the medical science it is impossible. So how you are doing it possible? With this Ayurvedic treatment, you are saying this stage, second stage, third stage AVN is possible to reverse into the normal condition or normal state. How it is possible? Because in the medical science it is completely, all the doctors, all surgeons, they are saying it is impossible to reverse. So let me start with the patient exactly, because they will share you the information, what she has observed, what she has struggled, what the trouble she has faced in the initial phase, and when she got to know about the avascular necrosis. So I'm going to the patient side. So she belongs to Hyderabad, and now over to you. So basically, where are you from? Hyderabad only, right? So you're from Hyderabad. Your name?
Sri Lakshmi.
Sri Lakshmi, okay. Your husband?
Yeah, my name is Sai Kumar.
Okay. So Sai Kumar and Lakshmi, what was the story? How it started, and what was the condition when you got to know first time in the MRI there is avascular necrosis? So what was your situation, and that it was new for you, or have you heard earlier this disease in your near ones or dear ones?
No, I would like to tell in Telugu because
no problem.
Okay. In 2022 మాకు ఏంటంటే కింద కూర్చోవడానికి ఇబ్బంది అవుతుండే. సో నేను ఆర్థోపెడిక్ డాక్టర్ దగ్గరికి వెళ్ళాను. తను ఎంఆర్ఐ సజెస్ట్ చేశాను. సో ఎంఆర్ఐ ఏంటంటే ఒక లెఫ్ట్ లెగ్కి థర్డ్ స్టేజ్ అండ్ రైట్ లెగ్కి సెకండ్ స్టేజ్లో ఉంది అని చెప్పారు. సో దానికోసం నేను సర్జరీనే, ఇంకా వేరే ఆప్షన్ లేదు అని చెప్పారు. సో మేము సెకండ్ ఒపీనియన్ కోసం వేరే ఆర్థోపెడిక్ డాక్టర్ దగ్గరికి కూడా వెళ్ళాము. సో తను కూడా సేమ్ అదే చెప్పారు. దెర్ ఈజ్ నో అదర్ వే, యూ హ్యావ్ టు గో ఫర్ సర్జరీ అనేసి చెప్పారు. సో మేమేం చేసామంటే నెక్స్ట్ మాకు తెలిసిన ఆయుర్వేదిక్ డాక్టర్ దగ్గరికి వెళ్ళాము. అక్కడ ఏంటంటే ఓన్లీ మెడిసిన్స్ వాడాం ఓన్లీ 1 year వరకు వాడాం. కానీ ఏ రీజనరేషన్ అవన్నీ ఏ ప్రాసెస్ అక్కడ జరగలేదు మాకు. సో మేము తర్వాత యూట్యూబ్లో సెర్చ్ చేస్తే మాకు శివయ్య హాస్పిటల్ గురించి తెలిసింది. సో అక్కడ ఫస్ట్ మేము వీడియో కాల్ చేసాం సార్కి. చేసిన తర్వాత సార్ ఓకే, మీ రిజల్ట్స్ ఇక్కడ ఎంఆర్ఐ అవన్నీ చూసాం కదా, ఇక్కడ క్యూర్ అవుతుంది, వచ్చేసేయండి అని చెప్పారు. అక్కడ మేము డిసెంబర్లో వెళ్ళాం, లాస్ట్ ఇయర్ డిసెంబర్లో వెళ్ళాము. అక్కడ ఏంటంటే రిపోర్ట్స్ అన్నీ చూసిన తర్వాత అక్కడ ట్రీట్మెంట్ చేశారు. 7 days ట్రీట్మెంట్ జరిగింది. అక్కడ నో కట్ అనేసి చెప్పారు. నో కట్, నో మెడిసిన్,
No injection. Right.
అని చెప్పారు. ఆ 7 days ట్రీట్మెంట్ తర్వాత 2 months మెడిసిన్ వాడాను. తర్వాత 1 month గ్యాప్ ఇచ్చాను. మళ్ళీ ఇచ్చిన తర్వాత మళ్ళీ వెళ్ళాను నేను. సెకండ్ టైం ఏప్రిల్లో వెళ్ళాను. అక్కడ తర్వాత మళ్ళీ 7 days ట్రీట్మెంట్ తర్వాత 3 months మెడికేషన్ యూజ్ చేస్తాను. 3 months తర్వాత మళ్ళీ ఇక్కడ హైదరాబాద్లో ఎంఆర్ఐ తీయించుకున్నాను. ఏదైతే రిజల్ట్ ఉందో అక్కడికి పంపిస్తే సార్ చూసారు. ఓకే, నేను ఇక్కడ క్యాంప్కి వస్తున్నాను హైదరాబాద్లో, అక్కడికి వచ్చిన తర్వాత ఒకసారి చెక్ చేస్తాను, ఇక్కడికి రండి అని చెప్పారు. ఇక్కడికి వచ్చిన తర్వాత మళ్ళీ ఇక్కడ లైట్గా ఇంప్రెషన్ ఉంది, దెర్ ఈజ్ నో ఎవిడెన్స్ ఆఫ్ AVN అని చెప్పారు ఎంఆర్ఐలో. సో కొంచెం లైట్గా ఇంప్రెషన్ ఉంది, ఈ ఒక్కసారి చేయించుకుంటే అయిపోతుందని చెప్పారు. సో ఇక్కడ మేము క్యాంప్లో కంటిన్యూ చేస్తున్నాం ఇప్పుడు ట్రీట్మెంట్. థ్యాంక్ యూ.
Oh my God. Something I got to understand, but little bit.
Yeah.
And as I have heard, like she said, Ayurveda treatment she started,
Yes.
and then after that, she went to orthopedician. They suggested operation.
Yes.
Right.
So normally what happened is, as we got to know about this problem, so we just went for second opinion with different orthopedic doctors.
Correct. Huh.
Because it's not a small thing, and so everyone is saying like this has to go knee this hip replacement, they have suggested in that way.
Correct.
So we got to know. So then we have so operation means itself is we will be having different opinion normally, normal people. So in future again we will be facing more problems because of that. So then we have went for 2 to 3 different opinions with the doctors. They also said same thing. So then we started thinking, and we got to know one of my family doctor who is doing Ayurvedic treatment. So then they said like best you can try once, because anyway you are planning to go for surgery. So the surgery can be done here now, and in future also it is kind of a surgery only. So in last stage if you make surgery, it will be surgery, and if you do now also it's a surgery. So then we just wait for, we have some spent some patience and taken some medication. So with that medication we got to know like she has some swelling in the nose, in that way. So
Okay.
she is not able to move the hip also.
Okay.
So then with that medicines, so she that was cured. So some part is done. So then the gene regeneration is not happening. After 1 year,
Correct.
we every 6 months we are monitoring. Then we have not seen that much change, but she's not facing any pain in the
Okay.
hip until she followed some medication, right? So if he stops, at least we try to stop like how the with the medicine only it is working, or normally that with that medicine that get cured or something happening, we just stopped for some days, so that again she's getting pain. So she faced some pain. So that means with only medicine, whenever she take medication, then only the pain is reduced.
Correct.
So we cannot continue our life every time that medicine.
Right.
So we have again tried to take this X-ray after 1 year. So because she's doing day-to-day activities. Normally in the starting when we went that orthopedic doctors, so they said like if she do any work kind of thing in home based need work also, then she will be, that cartilage will loss.
Right.
It will be
Right.
reduced.
Right.
They said. So we thought of again after 1 year this medication whatever we followed, right? So we tried checking so whether that cartilage in same stage or whether
Right.
how it was.
Correct.
Then we have seen the change wherever the first time the change is there, till that change is same.
Okay.
Because that means the medicine is somewhat working, but we are
The
not getting
symptoms only.
regenerated.
The symptoms only.
Yeah, symptoms. So the regeneration is not happening. So we thought of like at least there should be some exercises, physiotherapy kind of thing. Then only that part will move some part, so that the blood circulation will happen.
Correct.
In that way.
Correct.
Then we have started looking and browsing. One day she brought my wife just seeing all the research in the YouTube, and she found the Shivaya hospital. So then she used to tell every time, so just we'll try with this. So my
Distance
my
was very
yeah.
much, na, and it
So I was busy with my works, and so I used to do whenever I get some time doing research.
Correct.
And in the meantime, that treatment is continuing,
Okay.
whatever treatment. So then all of a sudden we just tried. So after seeing the X-ray of 1 year, so we just tried to talk with one day with Avinash sir. So then we got the appointment in a week. So
Correct.
we got, and we got to know like there the treatment can be done and it was cured. And we have seen so many videos from last 6 months before going to
The
call you.
hospital.
So we got to know so many people are saying at least some part will be reduced in my mind. So then better go and meet the. So we started then on December 2023 we just came over there and we started treatment. Initially in the first 1 or 2 sittings she got to know like some relief has seen. So then we have continued because in this treatment there is no internal part any damage inside. So normally there is no cut, no injection and no injury in that kind of thing. So then we got some interest and so let's continue for 7 days.
Correct.
Let's see for first time. And she got some improvement in the
first treatment.
And we followed that medication, and she also followed patiently so this
No doubt.
exercises, diet, everything. So she kept so much of dedication from in the morning and daily 1 hour morning and 1 hour in the evening. And the diet, everything we also followed same in the home everyone. So that at least she gets some motivation and
Correct.
she will be
Obviously.
doing. So that is the one point which I can appreciate her, because the following the things is difficult. So then after the first treatment we just stayed for 1 month. So same thing I have tried previously in the medication. We have seen pain after stopping.
Correct.
So we tried doing here also. Then she did not face that much problem. So we got some positive on it.
So
and again
means you have also tried one more time.
Yes.
Like that.
Yeah.
Like is it correct Ayurveda or like the same thing we are following?
So whether that regeneration is happening or not.
Correct.
So we come to know that it is going cool. So then again we only just take an appointment again. We went for second treatment. So as doctor suggested, so this time he said like we got full confidence like we will not go for third time. So the same thing what we expected, and the treatment also went good, and things went very good in the hospital, and the staff also very patiently doing everything, and she felt very good in the second treatment. And with that we thought so this will be the last. So then whatever we thought and what are the dedication that we put and the efforts that doctors and staff kept, everything is done very good. So finally the results got through.
Correct.
So that
she got normal report.
Yeah, normal report, and what we expect. After seeing report, we thought in different opinions, so we are not understanding. So then immediately we have taken appointment. Then we got to know that doctor, after seeing the results, very happy. He said like it was cured. Then today we are here to show that reports and want to talk with doctor, and then we come to know like there was some mild impression.
Correct.
So we thought like why to take second chance.
Correct.
So
Obviously.
better cure completely as doctor suggested. So then we have taken the treatment, and now it was fourth day. So everything is done.
Correct. So
this
basically what I have heard from your side, I was listening you only. So what I have observed, like once you completed your Ayurveda treatment, you were not satisfied with that treatment. You were like that ki medications or treatment that was okay, but you were looking forward towards the complete solution. Correct. How the things it will cure from the inside, from the report, from the thing like which is not in the symptoms only. So I think that was the craving at that time you both were doing, right? You were searching, you're looking at that time what will be the next option for permanent solution, right? That you got to know about this hospital, right? I think that was the point only. Correct. So that was the story, and now I'm showing to you without wasting your time, because everybody wants to see the report, how it got to normal, and she shared all the story about her, like she followed very well, and like her husband also, he supported very much, I think, Hana?
Yes,
Because
and
that is why it is
yeah,
possible.
and one more thing I just want to tell, and even my family members also
Correct.
done very good job in doing. They have so much of patience in making the things, and they used to give
I
some
met
confidence.
with your mother,
Yes,
and I
yes.
have seen like she is
They
very,
used
very,
to
you
give
know.
some confidence and inspiration and motivation from
Correct,
them
correct,
as well,
correct.
because that cannot be done only we both of us. Right? We need to have
Right, right.
everyone's as a
Support
team,
is
yeah,
required,
support is
right?
needed.
Obviously, yeah. And
So,
I think you have blessed with the one child, right?
Yes, yes, we have one.
So, what
daughter,
was
yeah.
the situation when you got to know about like you are not able to like uphold
Yes,
up and
yes.
all? Like, what was the situation
I
like?
was literally cried.
She felt very bad, and she used to cry by thinking about that. And every time she will normally the kids will prefer normally ask everything mother. So we need I want
Correct,
this
correct.
that affection everything will be there. So
Right.
sometimes she felt like feeling like depressed, like because of not putting
Understand.
interest on her because of this pain. So that was a very problem to her. So that is also one
So
thing.
now I am going to
And
share.
then as we have a daughter, so we cannot live here. Then we have started going there with her, and she also there with us with like 10 to 11 days.
Yes, right.
That is
Remember,
also
remember.
one-
Okay,
one big
no. It is
thing.
like
Yeah.
it is a very painful moment. I can understand because
Yes.
if I think you are the housewife, right? So you have to do all the things in the home and for your baby also. Everything
Yes,
like you have to
yes.
manage. And if some one female is suffering in single home, na, I think entire family affects
Family,
much,
yes,
right?
yes.
So it is basically it is a direct or indirect pressure for everybody. Like if she is suffering because she is a caretaker, she is taking initiative, na,
Yes,
to
yes.
take care of everyone's, right?
Correct.
So that is why I'm just now leave it because it is a very emotional side. Once I will go into or give okay.
Yes.
So this is the story. Like and now I'm sharing you the entire MRI which was done by the October 2022. That was the first MRI when she did, and that was the thing he was telling, and he was sharing the experience. Like after that he went for the Ayurvedic treatment, and he got to know about the results and the symptoms only, not in the MRI. So that is why he decided to come to my hospital. That was the first MRI when she did. That was October 2022, and that was the first MRI. �M.𝒊𝒏𝒈𝒉 and 28-year-old female. That was the first MRI, and now after my treatment you can see the recent MRI, 25th August 2024. That is findings you can understand here. There is nothing it is showing here. You can easily read all the things line by line, and I'll turn this paper also. You can see earlier there were the findings. Here are also findings, but earlier the findings it was clearly showing diffuse marrow edema in the both hip joint, minimal fluid in the left hip joint, early degenerative was a lot of things which is showing earlier, and you can see here the subcondylar fracture. This is the main point I have to showcase to everybody. That was noted in both hip joint involving subcondylar lesion, subcondylar fracture with double line sign. That is, you can see if everybody, like anybody suffering with the avascular necrosis, they can also get this point in their MRI report. And the impression it was clearly showing the third stage of avascular necrosis in the bilateral side. You can see avascular necrosis of both hip joint, left is greater than right. That was the scene it was clearly showing in the first MRI. Now the recent MRI, you have read all the things, and now the second page I am in the impression. There is no evidence of avascular necrosis. You can say little bit osteoarthritis changes is showing, but it is normal. Rest is the inflammatory changes of inflammation, that is a little bit inflammation, as I said to you. Nothing AVN it is showing. No significant subcutaneous, no visualized, and no significant focal lesion visualized. Everything is normal, and you can see in the findings also there is nothing. So there is no evidence of avascular necrosis. Earlier it was showing because of it was third stage AVN. Class C denoted towards the third stage of avascular necrosis in the bilateral side. Right and left both were badly affected. But I'm not sharing you the reports only. I'm sharing you the films also. Like films, what films were telling at that time when she got to know about the AVN. October 8, 2020, that was the first MRI film. She got to know AVN. You can see here. This is the avascular necrosis. This is also. And here also you can understand. This one picture. Here also. The patches. Here also. That was the first MRI. Now after treatment, the MRI film is showing the complete reversal or complete changes. You can see here. It is clearly showing this. You can see here. This one also. This one also. This one. This one. It's a blood supply which was obstructed, but now it is clear. So that is why bone is not deteriorating. And as earlier it was diagnosed with the third stage of AVN. Now there is no degeneration. It is showing here. So that was the second MRI, 25th August 2024. That was a recent one. So this was the condition, and you can observe properly the MRI film, because only with the reports we can't say that it is completely cured, because if reports and films both are in the very equivalent form, then we can get to know about that it is correct, it is like proper reports. So this is the condition what she had, like, and when what she had in the earlier state, and she got to know about this hospital and she came for the treatment, and that was the story. Like, that was the craving, like she want to get rid of this disease completely from the roots. That is why he decided to come to my hospital, they both of us. And what was the situation? She followed very well, and I want to tell everybody, if you want to get rid of the disease, any disorder, not avascular necrosis, so you have to be very, very sensitive, you have to be very, very careful, you have to follow all the instructions as she followed, as she shared to everybody, like you have to do all the things and be patient, okay? And one more thing, she forgot to tell everybody, like, it will take time, because if you are looking forward for the permanent solution, almost she has completed 6 months. She has given 6 months. August, it was like she started treatment from December, and almost August, she has followed everything, each and everything, and with the very patiently she followed, and that is why she got to know the normal, and she got to know the conditions that is very much normal. And what about the symptoms? Srilakshmi, is there any problem you are facing in that duration, walking and your activities?
No, nothing.
Now it is completely normal,
Yes.
without any problem. Have you ever danced after
Yes, of course. In Telangana, we did 𝒊𝒏𝒂𝒔𝒉, right?
Okay.
At that
Dandi.
time,
So when you went for that, in that duration only?
So
Yes.
recently, after completing second treatment, I think she went, right? We
हाँ.
went to second treatment after completing.
in
She
Ganesh
tried.
Navaratri.
Yeah,
Okay. मैं चतुर्थी, गणेश चतुर्थी and all.
Yes, Ganesh Chaturthi and 𝒊𝒏𝒂𝒔𝒉, normally we used to have the tradition.
So you danced like at that time?
Yes.
Yeah.
Very nice. Yeah. So any pain you faced after that? Everything was normal, right?
Yes.
Okay. So now what is your family condition right now? I mean, family, the atmosphere in the family after when she or your family got to know you are in a normal state right now?
They are very happy.
Everyone?
Yeah, everyone is very happy, and so we thought, like, we did not expect it like this much less duration, because we have seen these results, right? So we did not expect it.
Only 6,
But
I think 6-7 months only, you know?
Yeah.
I think it was complete. And 1 year before, like 2022 to 2023,
Yeah.
you were like searching
Yes.
to
yes.
many doctors.
Many doctors, and after knowing this, immediately I have taken appointment with every different doctors in orthopedic related,
Correct.
like famous orthopedicians in Hyderabad.
All the ways.
All the ways.
When you got
so
to
we
know
have
doctor.
taken appointment, and we tried some PRP kind of treatments also they mentioned. So, but
You didn't go for that?
No, I was not interested because the mainly I looking for is so it's a very a small age, right? So
Correct.
because,
Very young.
age. So young age. So it's not the correct step where
Correct,
we
correct.
can take for surgery, because the lifespan again it will be less. So if at all, let's wait for some time and try for Ayurvedic. Then in future, if at all, if we really need it, then we have that option. So
Correct,
then
correct.
why can't we try in this way? So we just followed it.
So it was difficult to plan from Hyderabad to hospital. It was
Yes.
difficult to take a decision.
Yeah, actually we have kid, right? So I did not take that much risk in coming this flight, and even my parents also there to support us. So
Correct.
So we all five came in the car only.
Yes.
So till there, because the main thing we are looking is that time after Corona. So it's so that handling the kids, it's difficult.
Correct. That's why
like,
you decided to from Hyderabad
Yes.
to my hospital. How
Yes.
much kilometers was there?
So almost 1500. So up and down it was like
3,000 kilometers, more than that.
Yeah.
Oh my God.
So we came by car, and so we have stayed like in the first day Nagpur, then Jhansi, then third morning we were there.
Okay, 3 days you
So,
have taken to
yeah.
reach to my hospital, right? So any problem you faced? Yeah. What about the hospital atmosphere and all? If somebody, like after your words, if one female or two females, they are like looking at you, they were listening you, and they tried that they started to like follow you, and they decided to come to my hospital. So it was like, what message would you like to give to all the females?
ఎవ్రీథింగ్ ఈజ్ ఫైన్ దేర్. సో ఒకటే ఏంటంటే వాళ్ళు చేసేది 50% ఉంటే మనం ఫాలో అయ్యేది 50% ఉంటుంది. ఖచ్చితంగా డైట్ ఫాలో అవ్వండి, మెడిసిన్ ఫాలో అవ్వండి, ఎక్సర్సైజ్ ఫాలో అవ్వండి. ఏదైనా ఆన్ టైం మనం 50% ఉంటేనే అది కంప్లీట్గా క్యూర్ అవుతుంది. ఓకే.
What are the safeties and all, like females in the hospital premises?
ఎవ్రీథింగ్ ఈజ్ గుడ్.
You were feeling comfortable at that duration? Any problem you faced?
నథింగ్.
Okay, so because as a female, I want to ask you, because it is not easy to start journey from another state where the language is the biggest barrier, and that was the problem she faced, and she got to know about the hospital which is situated in Uttar Pradesh. So it is very, very difficult to take a decision like we need to take one more step towards the disease, and where we are going, it is in the Uttar Pradesh. So this is basically one more thing. It is clicked in the mind, like it is what will the facilities we will get, and the atmosphere, the patients, the hospital is exactly located on that place or not. It is because you have seen the things in the.
Nothing is difficult than bearing the pain.
Very good line here. It's very touching line. It's nothing is more difficult than the pain. That's very true, because all the things, all the questions, it is secondary. But if somebody is suffering with the pain, so I think that is the own top priority.
Correct.
Very, very true words you have said. And that is, it is very, very common for each and every patient who belongs to South, I think, especially.
Yes.
It is not easy to take a decision from that place to here.
Yes, correct.
And you have seen the patients like anything. Every day the patients, they are coming from all over the corner of the South.
There is
Yeah.
language problem also.
Language problem.
Yeah, there was language problem and this thing.
Ah.
So, but there was everyone is coming. So with them, so it is not that much difficult to
Correct.
face, because the main thing, the problem, if doctor understands the way you communicate, so that can be understood and properly solved. Yeah.
Correct. Now I will see the movements, because if the report is saying normal na, so I think movements, it doesn't matter. And movements, because I don't want to tell you ki movement kaise honge, like how she's feeling right now. She is completely normal in their life, in their all the activities. She is doing everything. Am I right?
Yes.
So she is doing all the activities. She is do all the movements, all the whatever the restriction I am saying in my videos, and the people, they are asking, sir, how much time it will take once I will start, when I will start my normal life. So she is the biggest example in front of you. After the report, once the report is normal, everything is normal. Symptoms is just a symptoms only, okay? Once we will looking forward towards the normal treatment or the permanent solution, symptoms, it will automatically subside. This is the benchmark of your hospital, and we are doing in a lot of patients we have did, and still we are doing, and in future you have seen a lot of changes, a lot of MRI reports like in my YouTube channel. Okay, so can you show me the movements? It is a formality only, as you can say. Anything.
Earlier, I was not able to stand like this.
Earlier it was there's a problem to stand and
Now I can move.
any problem, anything which you were doing earlier after COVID, like after avascular necrosis, that was restricted. Now is there anything which is restricted in your life?
Because of some conflict in the
Huh?
I couldn't sit in because
Just show it to me, no problem.
yes.
Fine.
Yeah, actually, previously she can't sit in that way,
Ha.
and
She was also hesitating,
Yeah.
She was telling me, sir,
Yeah.
I am not able to sit in the. Well, just try it. Because no, everything is fine. So that
Yes.
thing, I think that is nothing to worry. Earlier, I have said to you, you have to stop all the things.
Correct,
Just
correct.
cross leg, walking not more than 500 meters. That was a restriction.
Yes.
For until you are not getting the proper reports or MRI in the MRI. Now you have got the normal report. So I think there is no restriction.
yes, correct.
Okay. So why you are getting just everything is fine.
And she used to not able to walk properly also. So that right leg she used to put into take the help from this left hand.
Left one.
Yeah, in that way she used to. Now she is not. She is able to walk properly and stand.
Show me the walking
So-
step. Okay. Very good. Great. Normal.
Yes, yes.
It is because every report is normal, so symptoms it is automatically will be normal. It is because earlier when you got to know about the Ayurveda treatment, you were looking at the symptoms only.
Correct.
That's why symptom was reduced, but there was no changes in the MRI.
Yes.
Now what we have done, we have focused on the disease only.
Correct.
That is why symptoms automatically you got the normal
Automatically.
things. Okay, so that was the story of Sri Lakshmi, and I just want to one thing say to everybody who is watching this live video, that you have to share to everyone who is suffering with the disease of avascular necrosis, and it will be problematic once you got to know about the AVN and your life is completely changed. I can understand because every day I'm treating such cases with the help of Ayurveda, and it is very difficult, I can say. As they shared, she blessed with the one child, and that was the situation. Even after that, she was not able to hold her and hug her. That was the situation. You can understand. So now the same thing I want to tell you. If you are watching this video, so keep sharing this. All the females, especially who are suffering with this type of disorder, especially avascular necrosis, and definitely she will also get the same results as she got from this Shivaya hospital. The same thing I'll do it, and one more thing, you also have to give 100% as she given to me. Okay, so thank you so much, all of you. Keep sharing this video. Last final word to everyone, from your both the sides to the patient.
So mainly the thing is you should be more patient and you keep understanding the pain mainly. So you need to monitor daily, while doing these exercises, diet, everything day to day. You need to focus on your pain. So how it is reducing or it's getting more, and what type of exercises you need to follow. All these things you need to monitor, and mainly is this dedication is very important in
Correct.
doing the things, and doctor and the staff every time they will be available whenever you feel any pain or problem during your exercises or anything. So that is the one thing. So you need to mainly focus on your day-to-day activities and focus on your pain mainly. So you will understand the things.
Correct. Thank you so much, all of you. Thank you so very much, and I wish you you will live your life very healthy, very happily, and you will feel very energetic in future also, and you will achieve your all the dreams. Your dreams will come true, and that is my wish to all of you, to your family. Thank you so very much.
Thank you.
Thank you.